of our members here this morning. Before I turn the program over to Jesse, I'd like to thank our sponsor, Baystate Health, for their continued support of the Chamber and, of course, for making this breakfast possible today. We'd also like to thank our hosts, Abbas, and the entire team at Taraza for opening early this morning. And lastly, a special thank you to GCTV for making this program accessible for those who are able to attend this morning. At this time, I'd like to welcome Bessie for announcements.
Thanks, Shelby. Good morning, everybody. It's so great to see you all. There's so many of us here today. This is great. I am going to choose not to believe that it's solely for the fact that it's spring, it's light outside, our microphone is working today. We are off to a good start. This is going to be a great breakfast. And of course, we have a deeply informative program for you today, for which I'd like to thank our sponsors, Baystate Health and Baystate Franklin Medical Center. I'm going to go throw the program over to Ron here in a minute, but before I do, let's welcome some new friends to their first Franklin County Chamber breakfast. You can stand or give a wave when I call your name. Welcome to Tom Brogel of Deerfield Cabinets and Millwork in Greenfield. Chet is joining us this morning from Ray's Pros. Welcome, Chet. Welcome to Addie and Alice from Ice Cream Emergency. They wore the right outfits. And you may have seen they have the ice cream bus outside and they have invited us to check it out after the breakfast. So they did let me know it is heated. So Ice Cream Emergency is not just for your summer events. Think of them for the winter too. Kelly Ben Ezra. Is Kelly here? I didn't see her, but Kelly Ben Ezra was joining us in her new role as the Director of Shelter and Housing and Clinical Support Options. Dan O'Neill is here from M&T Bank. Welcome, Dan. Welcome to Office Manager and Senior Leasing Agent at Olive Street Development, Adele Ferreira. Morning, Adele. Rich Brinda is here with our friends from All States Materials Group. Welcome, Rich. Lieutenant Paul Leslie is here from the Salvation Army of Greenfield. And then we are delighted to be joined by a number of our friends from Baystate Health. Please help me welcome Dr. Robert Baldor, Stacy Barone, Sandy Campbell, Anita Fritz, Mike Kanapic, Jill Pell Artis, and Deb Provost. Not all of them are experiencing their first breakfast, but we wanted to welcome them as a group. And then last, but definitely not least, and you'll see why in a second, Aaron Best is joining us here from Dead River Company. Get that? Not last, but best. There we go. Welcome to all of you. I'm so glad to have you here. Before we jump into chamber announcements, I want to put my RTC hat on for a second. So, as you know, in addition to operating as your Franklin County Chamber of Commerce, we also serve Franklin County as its Regional Tourism Council. We're one of 16 RTCs in the state. And as you may remember, we were just awarded a $1 million travel and tourism season extension grant in partnership with our friends at the Greater Springfield Visitors and Convention Bureau, the Mohawk Trail Association, One Berkshire, and our southern neighbors, the Hampshire County RTC. And this collective grant really gives us the opportunity to tap into a much wider audience than we'd be able to do on our own as an RTC. And it really is such a huge win for Franklin County and for all of Western Mass, especially when it's combined with the power of our record-breaking RTC grant that we just received in January, which was 75% overfunded than last year's grant, which at the time had held the record for our best grant ever. So we are doing well on the tourism front. I'd like to thank Lisa for all of her work with our tourism marketing. We've got a number of really exciting, really exciting opportunities that we purchased, but exciting nonetheless. We have a pretty hefty advertorial with Yankee Magazine and with the Wall Street Journal. New York continues to rank as one of our top 3 markets, so we will be sure to share the news when those come out. We are also working on a brand new standalone tourism website. So there's a lot of great things happening on the tourism front. So really great news, which is great because as we know, the $79 million that tourism brings into Franklin County each year is a welcome injection into our small businesses and our local economy. So we're thrilled to be doing as well as we are on the RTC side. So I just wanted to share that with you all. Moving on to more exciting news. You may have seen in the Recorder a couple weeks ago that almost 20 years of touring nationally, internationally, Charlemont's own PT Theater Company has an opportunity to create their own theater. The theater will be a centerpiece of a 35-acre arts and ecology center serving local children, teens, and families, and will strengthen the economic base of West County. PT Theater's artistic director, Jonathan Mirren, is here with us today. This is the theater's first capital campaign, and they are already approaching the halfway mark. Please see the flyers at your seats for more information, or get in touch with Jonathan. He's here in the back, giving a wave, if you'd like to learn more. Franklin County's YMCA is hosting their annual Healthy Kids Day on April 29th from 10 to 1. Healthy Kids Day is a national event put on by Ys across the country, and it's a great way to bring the community together, not just to see what the Y does, but also to spotlight our local businesses and organizations. Last year, the Y had an amazing turnout, and they're looking to grow the event this year. If you are interested in having a table for your organization or business or would like to get involved, please see Grady. I haven't seen Sarah yet. Is Sarah here? Okay, see Grady after the breakfast and he can connect you with Sarah. And after you sign up with Sarah, you can break it down with Green Space Co-work, because as we know, the Business Breakdown Series is a monthly discussion and networking event celebrating innovative entrepreneurship in Greenfield, hosted by Jeremy Jeff at Green Space Co-work. The next Business Breakdown is set for Wednesday, April 5th, when we'll hear from our friends at Adam's Donuts, which obviously you do not want to miss. I have to do at least one bad pun per breakfast. Business West Difference Makers Award will be held on Thursday, April 27th. This year's Difference Makers class does include Claudia Pasmani, who is my colleague at the Amherst Area Chamber of Commerce, and Gabrielle Gould from the Amherst BID. If you know them, you know how deeply they both deserve this award. Let's give them a round of applause. And if you haven't met them yet, you can meet them next week at Margarita Madness, which is happening on Thursday at Interstate 91 at 5. We have a number of Franklin County businesses that are participating, so please check that out. You can get your tickets online and vote for your Franklin County Chamber members as your favorite margarita. And speaking of Business West, I'm not sure that I'm actually allowed to announce this yet, but we can keep a secret, right? Yeah. I had the honor of being selected as a judge for Business West 40 Under 40 this year, which was really great. Thank you. And while I'm definitely not allowed to share who the top 40 young professionals in Western Mass are, I will say I was so thrilled to see so many Franklin County nominations. So thank you to everyone who took the time to nominate some of our local superstars. Franklin County was well represented. So even if it didn't work out this year, keep trying. Come see me for tips and tricks after reading, 200 of them. I have an idea of what we're looking for. So those top 40 will be announced in the May edition of Business West. But thanks for everyone who nominated. That was really great. And then the Salvation Army invites you to join them in celebrating 100 years of service to our Franklin County neighbors. There is still time to support their centennial celebration with sponsorships, and a limited number of tickets are still available for their dinner on Friday, April 14th. Fund raised through their Fill the Plate Centennial celebration will help them fight food insecurity and allow them to continue serving more than 800 meals each month through their weekday breakfast and lunch meal programs. For a century, the Salvation Army of Greenfield has continued to be a steadfast sign of hope to generations of our Franklin County neighbors during the greatest times of need. You will find a QR code on your tables for additional information and a link to the online donation page for this event. You can also speak with Lieutenant Paul Leslie if you have any questions, and Paul is here. There he is in the back. Okay, and finally, on Thursday, April 6th, you're invited to help Big Brothers Big Sisters of Franklin County celebrate some little moments and big wins at their Mentorship Awards from 5:30 to 7 at the Deerfield Inn. Big Brothers Big Sisters of Franklin County has a lot to celebrate right now, so I'm going to invite up Executive Director Jennifer Webster to help share some of those updates.
All right, good morning. How is everyone? I see on the program that Jesse gave me 0 minutes to chat, actually. But I was told I have 2, and if you know me, 2 is not usually enough for me to talk about things. So I'm going to directly read today, which I don't usually do, so I can try to stay at my 2 minutes that I said I thought I had. So, sorry, Ron, I'll try to be quick. Good morning. I'm Jennifer Webster, Executive Director of Big Brothers Big Sisters of Franklin County for at least the next 2 weeks. As some of you know, I recently announced my resignation from my current position to join Big Brothers Big Sisters of America's leadership team. But don't worry. Thank you. But don't worry, it's a remote position and I'm staying local. And I get to introduce Ron today and share with you that while I get to remain in the area, I will be staying deeply involved in one of the agency's newest initiatives that is near and dear to my heart and something I've wanted to do for the 10 years that I've been with our agency, and I'm finally able to do that. Let's see. See, I already went off script. Oh no. Well, you'll hear from Ron in a second about some of the ways that BFMC is supporting and investing in this community. I'm selfishly thrilled to be able to tell you about one example of an investment that will make immediate and long-lasting impact on the health of our region. Recently, Big Brothers Big Sisters of Franklin County was awarded a large unsolicited gift from billionaire philanthropist Mackenzie Scott. Ms. Scott has been changing the narrative of philanthropic giving over the past 3 years by using trust-based strategies that thoroughly and carefully vet potential recipients and give large unrestricted gifts that are intended to make significant immediate impact. BBBS of Franklin County chose to rise to this challenge and invest a portion of our gift in an innovative way by investing $10,000 a year for the next 5 years in the new Youth Empowerment Project. This groundbreaking project will grant funds directly to youth themselves with a trust-based philosophy and an inclusive, just application process that allows for young people in Franklin County and the North Quabbin to advocate for their own futures in ways that they feel confident about. This funding will give financial support for needs that a young person feels will help them on their path to graduation and post-graduation success. So this could look like class trip money, SAT prep course or AP class exam fees, equipment or machinery, gender-affirming services or clothing, mental health support, sports equipment, car repairs. Basically, if they can justify how the money is going to help them graduate high school or take the next important step towards their potential goals, they can apply for it. And the best part, what I'm most excited about, is that the entire process, from design and creation all the way through the funding decisions, is being led directly by a large group of young people. It is being managed by our Big Advisory Council, which is a member of up to 20 people. 2/3 of them have to be youth. And as of right now, we have 13 members that sit on this council and meet monthly to design the project that their peers will be able to apply for funding for. That's the part that I Now, while we're getting national recognition for our local and innovative solution to rebuilding young people's resilience, we know we cannot do this alone. We need to find other youth empowerment champions to make a true, sizable impact in our community right now. Our youth's mental health cannot wait. That's my plate. There we go. See, I should not go off screen just yet. Okay. Anyway, this is why I am so proud to announce that Baystate Franklin Medical Center, together with Baystate Medical Center and Health New England, is our first youth empowerment champion. Together, this group has matched our $10,000 investment for 2023, giving us the ability to grant $20,000 directly to young people in Franklin County and the North Quabbin by the end of this year. With Baystate Franklin Medical Center's help, we will show young people in this community that their voices matter, that we believe in them, we see them, we trust them, and we are here to support them. We are so grateful to you, Ron, for trusting in us as we launch this vital community health initiative. I am honored to be able to still lead this project with your support, even after I step down from this position. I will remain the chair of the Big Advisory Council and manage the Youth Empowerment Project along with our young people. It's incredible to see other leaders of our community joining us in walking the walk of our bigger together mentality and finding innovative and collaborative ways to keep our communities safe and thriving. Thank you so much for your investment. So that's enough for me. I will turn it over now to Ron, and you'll get to hear lots more about the ways that they are helping invest in our community.
All right, thank you for that great introduction, Jennifer, and we're so glad to be able to help. There's a lot of programs in this community and a lot of folks that do wonderful work, and the Big Brothers and Big Sisters is one of them, and we're just happy to assist in any way that we can. I gotta get rid of some stuff. All right, first let me say a few words about, Madam Mayor. Hi, I gotta say hi. She's been very supportive and a great partner of ours through the last 3 years of COVID. And I want to recognize my team here at Baystate Franklin Medical Center, and in particular Deb Provost, who is the Chief Nursing Officer and the Chief Administrative Officer for Baystate Franklin. We just went through a 3-day survey, a joint commission, and if you don't know what that is, they come and kind of look up everything that we actually do for the last 3 years and all the rules and regulations, and we came through with flying colors, and Deb's team did a miraculous job. Just know that hospital is in really good hands with Deb. There's a tremendous team there, and we've done some wonderful work in the last 5.5 years. 5.5 years ago, Deb and I got thrown together. I don't even think we knew each other. And I said, you both are going to Franklin. And it's been wonderful. It's really, it's won my heart over, and I couldn't be more happy to be part of Baystate Franklin Medical Center. I just want to, that's actually a very good picture. So, I'm not sure how old that is, but I don't think it's recent. First, I want to thank the community. This community and the support. So this March here, right now, March, right? So I'm from Worcester. So March is, it's been 3 years that COVID hit. I was actually in South Carolina 3 years ago, March of 2020, and I got a text, and it was like Baystate Health saw their first COVID patient. And then I came back, and all hell broke loose. And everybody can remember, those first few months and that first year, and it was incredible. And, as an administrator of a hospital, you don't know what to do with these things, and I don't have a clinical background. And I called I probably shouldn't even tell this story. And I called the infectious disease expert, our epidemiologist, Dr. Sarah Hessler, who's a good friend of mine. And I said, Sarah, what do I do? And she guided me through it, and we had a great team and an incident command team. And Baystate Franklin Medical Center, I couldn't have been more proud of what they did in 3 years. Oh, the support that we received from the folks in this room and the community at large was really something to behold. So I want to thank everybody in the whole community of the support that they gave Baystate Franklin Medical Center in the last 3 years. So give yourself a great round. I'm just going to give you a few stats of the last 3 years and what we saw. There was, in the inpatient side, we saw 761 COVID inpatient patients. Of those, unfortunately, 33 expired. We discharged home 415 of those inpatients, and 313 of them went to SNFs, which is skilled nursing facilities. On the ED side, just over 1,200 patients came through our emergency department with COVID. And then we got the discharge, just over 1,100 of them home, which is miraculous. Terrific job by the emergency department. And then again to skilled nursing facilities and other facilities, just over 100. That's a lot for a small hospital. So they did a tremendous work, and again, thank you for all you've done. Next slide, please. Now, this is our mission. Everything that Baystate Health does and that we do at Franklin Medical Center comes down to this. It's to improve the health of the people in our communities every day with quality and compassion. That's everything that we do is built around this mission, and it hasn't changed for 100 years or so. It's been there forever, and it'll stay there forever. Next slide, please. So these are our hospitals. We have Baystate Medical Center, obviously, that you know, in Springfield, about 700 beds. That's the mothership, as we call it, Academic Medical Center. We've got the, on the top right is Baystate Franklin Medical Center. You can see the spokes, we call them the spokes, our med-surg unit, spoke 1, 2, 3, 4, 5. And it looks like a wheel. They designed it in the 70s. If you look at it from an aerial view, pretty tough to staff that way. I don't think we would design it like that these days, but it was a different reimbursement model back then. And then the bottom left is Baystate Wing Hospital, which I've been lucky enough, I guess, they asked me to oversee that one too last October. And then where I started in my career with Baystate Health is Baystate Noble Hospital. I started there 13 years ago. August will be 13 years. I was the president and CEO for 5 years. We were independent, and then in July of 2015 we affiliated with Baystate Health. And then, honestly, I thought that was my end of my career with Baystate. And then we went, 2 years later, they asked me to come up here and join Deb and run Baystate Franklin Medical Center, which has been great. And then last October, now I oversee all 3 regional hospitals for Baystate Health. So a little about Baystate Health. Big organization, about $3 billion in revenue, 13,000 or so employees, only level 1 trauma center and tertiary center in Western Mass. I can't emphasize how important that is, that we're the only level 1 trauma center in Western Mass. You don't want to be without a level 1 trauma center. Academic Medical Center, we're affiliated with the UMass Chan Medical School and Baystate Regional Campus. We're the only campus outside of UMass that's affiliated with UMass Chan Medical School. So we are a arm of them. It's a full-service medical school. We have students, we have residents. We've got over almost 1,000 licensed beds. 4,600 babies born every year at Baystate. About 450 of those babies are born at Franklin. We're very proud of that. Franklin Medical Center is the only community hospital of the 3 community hospitals that still has an OB program, a birthing program. Every intention to grow it and keep it, although I can't make people have babies, but we try. We do about 188,000 emergency visits overall in the system. I think that's actually a little low. We do about 90,000 visits in the community hospitals. Franklin Medical Center alone does 25,000 visits a year, and we admit through the emergency department about 250 patients a month. That's not including our behavioral health patients or our birthing unit, which we do about 40 or so a month. 37,000 surgeries, that's a lot of surgeries. At Franklin Medical Center with the new surgery center that the community was so gracious to help us build, we do about 2,400 surgeries. Some of the programs that we've been building over the last couple of years has been our new breast program. Under Dr. Holly Mason, we rotate breast surgeons through the community. That's been growing. We've also, Deb Provost is actually working on growing our, and revitalizing our orthopedic program, We have a partnership with NEOS, which is New England Orthopedic Services. They're here now on a regular basis, and we have plans to expand their hours and to expand the clinic here, right here in Greenfield. We've gone through more of a model with the system over the last couple of years. You know, it used to be that you had a lot of independent physicians that would work at hospitals, and that's how community hospitals operated for many, many years. That's unsustainable now. With the reimbursement models that happen, with the new technology that's happened, with the way medicine is going on the outpatient side, what we've done is rotated our specialists through the community so that not only can we have the care that we need in the community, but we can bring more specialists to the community. It was painful at first. A lot of folks think, okay, you're losing services. But if you actually look at the services now that Franklin Medical Center offers compared to what was offered in the past, there's actually more services there. And they're done by specialists, people that are experts in that area. And that's all they do, is that type of work. So we got 3 community health centers in Springfield. You know, so I mentioned 13,000 employees. We're the largest provider of care for the underserved in Western Massachusetts, which we're proud of. Probably shouldn't be, but we are. It doesn't pay very well, but that's our mission, right? We take care of everybody. Anybody that comes through our doors, we take care of. We've got 80+ primary and specialty care offices. We provide over 160 million in unreimbursed care. That's a lot. And then obviously a lot of diagnostic lab tests, and we got a health insurance plan with 184,000 members. Next slide, please. So I just mentioned this, there's 13,000 employees. We got 700 employed physicians. That's a lot of physicians. What? Oh, slide ahead. I'm sorry, thanks. So Deb is being her typical self. She does. Now you know who runs the hospital. It happens to me every day. Ron, this is what you gotta do. That's okay. I told you we had a strong team there. So this is our revenue. I mean, almost 70% of our revenue is from the government. Medicare and Medicaid. And we all know that, you know, in the Pioneer Valley and in Franklin County, you know, we're an aging population. And so the Medicare side of it's going to grow. The Medicaid side, we are rolling out, we do have a Be Healthy program, which is a Medicaid ACO, which is population health. And that's run through our community health centers in partnership with Health New England in Springfield. That will be rolled out system-wide, I believe in July, somewhere thereabouts. So we will have a Medicaid ACO population health program here in Greenfield through our Health and Wellness Center over at 48 Sandon Street. And 31% commercial. The regions usually tend to have more commercial insurance than Springfield in general. And we actually have a pretty good payer mix up here. It is about 31% up here, just like the other regional hospitals. And then self-pay is 1%. Some of the economic benefits that Baystate Health provides to the Western region, we've got almost 13,000, as I mentioned, direct employees. It's over $1 billion, $1.2 billion of direct earnings for those employees. On an average, about 85 million of average annual construction investment, and we buy over 236 million of goods and services from the communities that we serve. So altogether, we have over 5 billion of an annual economic output, and we supply over direct and indirect almost 30,000 jobs in Western Massachusetts, and we support almost 16,000 households. That's a lot of economic output. So when you're thinking of Baystate Health, we want to be here forever and ever and ever because it is the economic engine of Western Massachusetts. Over 439 million in annual federal taxes and 228 million in annual state taxes. So pretty large organization. Next slide, please. We'll skip this one. So this is our service area. Everybody in this room knows this. This is our primary service area. We call it our PSA. This is Franklin County, and then we have 4 towns over in the North Quabbin region. it's amazing that most of these towns have 2,000 folks in them or less. And so that's a challenge for us, you know, transportation, housing, isolation, right? Lack of internet, iPhones, the like. You know, how do we take care of these folks? We work closely with our partners at the Franklin Regional Council of Government. V.B. Walker's passionate about this stuff, has taught me a lot about how that we go about handling these folks and what do we do to bring services to them. It's not an easy task, you know, because we know how to run hospitals. My expertise is hospitals. And when we get out of our wheelhouse of, okay, well, how do we get out into the communities? That's a difference. And we have to do it in partnership with other people. We can't do it alone. But that's a challenge for us, is having that many towns in a rural area. We're the only designated full rural county in Massachusetts. Next slide, please. This is just our services that I already mentioned some of them. We have the most surgeries out of the regional community hospital at Franklin. We're the only community hospital with the birthing center, and we're the only community hospital with an intensive care unit. Which is very important to us because, you know, with Baystate Wing and Baystate Noble, they're only 20 minutes from Baystate Medical Center. We can have different models of care, right? Because you're right there. We're not right there here. You know, I always say about Franklin Medical Center, it's a good thing and a bad thing. We're an hour away, it's a good thing. And we're an hour away, it's a bad thing. And, you know, people like to say it's 45 minutes, but drive up 91 and try to get through town and get in over to the hospital. It's a good hour. And anyways, you know, and I do it a lot. But, so we have to have more services at Baystate Franklin Medical Center. We've got to rotate more specialists through, which we're working on. We have to make sure that we have the birthing center strong. We've got to make sure that the ICU has the coverage, which is not easy nowadays. Doctors, you know, they don't like to move around that often. And, but we've made it work over the last 5.5 years, and Baystate Franklin's actually growing. So what does Baystate Franklin mean for the economic output in our region? It's $215 million we provide in annual economic output. Over 1,300 jobs, direct and indirect, that we provide to this community. 82 million in annual labor. And then 16 million in federal taxes and 9 million, almost 10 million in annual state taxes. So where we are, you know, we take this seriously. When we look at, you know, what we do as an organization, it's not only our mission, right? Because our mission is to take care of patients. Everybody that walks through our doors, we take care of. But we also take this very seriously, that we provide a lot of jobs and a lot of economic output for the community. That we, you know, that's important. That's important to us, that's important to you, it's important to our families, our households, our legislators. So we take this very seriously. Then we got a little about Health New England on the next slide. Pretty big organization. They provide almost 1,600 jobs, 500 million in annual economic output, another 131 million in annual labor income, and they support over 872 hospitals. Pretty unique that Baystate Health has their own health insurance company, Health New England. It allows us to do a lot of partnerships. One of them I mentioned was the Medicaid ACO, which allows us to get into population health. Baystate Health, most of their contracts and most of their patients that we see that are in our network are in risk contracts, which means we're in some type form of population health, which is really what we want, right? You won't hear this from too many hospital administrators, but really our job is to keep people out of the hospital. And, you know, I think if I said that in my career 20 years ago, I would have been out of a job. But you know, it's true. The work that we want to do and what we're trying to accomplish is population health, is managing the chronic diseases of the community so that they don't become acute, so you're not in the hospital. Trust me, there'll be plenty of folks that always end up in hospitals. And I always say, I don't want folks to get sick, but when they do, I just want them to use our hospital. But with that said, there is an opportunity, a huge opportunity for us to keep people healthier, to keep them out of the emergency department, and to keep them out of the hospital as inpatient. And that's the goal. And our president and CEO, Dr. Kerouac, is laser focused on population health and risk management. And we're probably in it more than most, I know we are, than most organizations in the country. Let's see, I don't know, how am I doing for time? I'm doing good? All right, I'm doing great.
I gave you more time than I gave members.
All right, well, we want to get the ball, too. Okay, so this is a little about Health New England. Let's see, I'm a little more than 181,000 members. It paid more than 105 million for COVID-related health claims. That's a lot. 18 million for COVID-19 testing. If you remember all the testing sites that we had, Deb Provost, you can thank her for setting all those up. I just kind of closed my eyes and said, oh my goodness, what are we doing now? But we had testing sites in Rydell Street, we had them in our conference rooms, we had them outside our door in the parking lot, and so you can thank Deb for all of that. Over 700,000 in community benefit grants, and they invested or helped raise more than $7 million and partnered with over 150 community organizations to support community benefit programs. So a tremendous partner of ours, and we're glad to have Health New England. This is our Baystate medical practices. So we have a few entities, if you haven't figured that out yet. Right? So we have HNE, we have our hospitals. We also have a children's hospital, which I haven't mentioned. And then we have Baystate medical practices, which is where we house our physicians, right? So they have their own kind of entity. That's what we call 48 Sanderson Street. So it's a medical office building across the street from the hospital. So those are mostly the BMP doctors. Although all the doctors in the hospital and outside the hospital are Baystate medical practice doctors, pretty much all of them. Sanderson Street right now is being converted to a health and wellness program. That came about through the family residency that we had to kind of reconfigure the building. We're lucky here, we have our own standalone medical office building. So we can, it makes it easier for us to provide the care and more efficiencies for our patients. So that's being turned into a health and wellness center. And I think, let's go to the next slide. So this is our strategy now and really in the future. So what we will have is about 5 health and wellness centers up and down the valley, right? We're right now currently converting Palmer Medical Center, which is inside Baystate Wing Hospital, into a health and wellness center. We'll have convenience care hours, which means that you'll be able to see your primary care doctor at night or on weekends. It's kind of our way to, kind of like urgent care, but a little better. It keeps our folks inside the network that we can manage the population better. We have one in King Street in Northampton, right? That's another health and wellness center. We have one in Long Meadow that was built a few years back. Sanderson Street will be the 4th one. So it'll be Baystate Health and Wellness Center, Greenfield. We will go to convenience hours. We'll expand our primary care to nights. We'll expand it to weekends. This won't happen overnight. It's not easy. But the construction is happening now, should be done by the end of the year. We just toured it yesterday with Dr. Kerouac, and so things are going pretty good and we're moving along. We'll have all our specialists on the 1st floor, we'll have our family residency program and our primary care on the 2nd floor, and then we can build around that. Those are the hubs that support the community hospitals. I learned a long time ago, right? This is a relationship business. Without doctors, you can't have a hospital. So we got to have a place where doctors want to come and work, right? So believe it or not, in these days, a doctor coming out of school doesn't want to come to a standalone office in a rural community. As much as I probably want to work in a rural community and do, doctors want all the bells and whistles. So if you build a health and wellness center and put a lot of their friends in there, they want to come. Because now you got the bells and whistles in there, and they say, geez, that's a pretty good place. And the other part of that is the family residency program. And that's, hopefully we grow our own there, and that they stay in our community and work in our community so that we have a pipeline for primary care physicians in the future. And that's the idea behind that. So between both of them, we can make it easier to attract, or at least help us attract physicians to this area, because we need physicians. There's a scarcity of physicians, there's a scarcity of access. I think the number one complaint that I hear is that, I can't get in to see a doctor. I hear that in the regions all the time. You're not alone here, I hear it in other regions. We know that as a system, and we're working on that. That's one of our 2025 strategies, is access to care. As a matter of fact, we're going through now a little exercise with all the senior leaders of the system, and what is it that we focus on? Because we kind of got to get back to basics, right? We've got staffing shortages, we've got all these other things that we had in the works. That, okay, we're going to do everything, right? Baystate likes to do a lot of things at once. And we're saying, you know what, maybe we only got to do one or two things here in the next couple of years, because it's been such a rocky road the last 3 years. And one of them that we've chosen is, how do we promote and improve the access to care for our patients everywhere? So we know that. It's just not as easy as me standing here saying it. And then the last health and wellness center will be in Westfield. Eventually we will, there's a few practices down there that are close to the hospital. We'll consolidate them, and we'll build out the inside of the hospital, as we are doing with the Baystate Wing Hospital. Neither one of those hospitals has their own medical office building like Franklin does. It's kind of a shame, I wish they did, but that's okay. We'll get through it. So then what we'll have is these 5 health and wellness hubs that will support the regional hospitals. And that will be a big win-win for us. So let's see what else we got here. So the behavioral health hospital, certainly not a topic that anybody's been shy to talk about. This is a, it's in some ways it's bittersweet, right? We're going to move our behavioral health inpatient to Holyoke. We're building a new hospital there. It's 150 bed with 120 semi-private rooms. It is in a partnership with LifePoint, which was formerly Kindred. It's a $70 million investment. There'll be 30 private rooms for the Department of Mental Health, a continuing care program. And it's specially designed programs for children and adults and geriatric populations. We could talk about behavioral health all day long. I think in the last 3 or 4 years, and actually a little longer than that, it was starting when I got here over 5 years ago, that we built an emergency behavioral health pods in our emergency department. Baystate Franklin has wonderful behavioral health pods in their emergency department now. But unfortunately, they're always full. We see a lot of behavioral health patients come through, and it's not getting any less. A third of our patients that come through our doors that need to be admitted are admitted somewhere outside the region, in the eastern part of the state. So we just don't have enough beds. The community hospitals that have the inpatient now, they're older facilities, very old, right? It's over 50 years old at Baystate Franklin Medical Center, and really is not conducive to care. It's not the environment that promotes caring and a caring environment for our patients. They do wonderful work, the employees are fantastic, the patients get great care, but to be able to give them a facility that is up to date with private rooms, with recreational areas, with enhanced dining, with geriatrics, with child and adolescents, which we don't have at Franklin Medical Center, is a big win for us. It doesn't come without its challenges, but knock on wood, I think it's a great thing. This is just some pictures of it. You can see them. Then the next slide. And if you go down 91 and if you're going south and you look left over by the Holyoke Mall, you'll see this thing before the leaves come on the trees. I mean, it's just standing there. It's pretty big. It sticks right out. And then before I hand it over to Bob, I won't go through all this, but how we work together. I think, here, one of the things I learned very early on about Franklin County and Franklin Medical Center is the collaboration that goes on with the Franklin Regional Council of Government, the Community Health Improvement Plan, the Community Coalition that cares, The CBACs, which is our Community Benefits Advisory Council, which is a group of agencies that come together on a regular basis, and we talk about how that we can help the community and the social determinants of healthcare. Some of that funding comes from, a lot of that funding comes from Baystate Health through our determination of needs. When we have a capital project, any capital project in the state by any hospital organization, the funds are doled out to the regions, and that's how we can then look at our region and say, well, we have a bucket of money, and who best can serve the community and where we should place that money. Tremendous work that goes on. I mentioned the family residency program, and then I can't say enough about the opioid task force. I think the work that the three co-chairs there, the sheriff and John Merrigan, the registrar of probate, and the Assistant U.S. District Attorney there, Dave Sullivan, what they've done in the partnerships that happen through that. Deb McLaughlin does a great job running it, tremendous. I almost feel like they make me like an employee. I get these emails, I got to do work, you know, and it's like, all right. And it's really good, and it is that feeling in this county is, you know, Phoebe Walker herself. I think Phoebe sometimes thinks she's an employee of the hospital, but you know, it's at first I was like, oh my goodness, but now I realize, you know what, it's actually a good thing. We do a lot of good work, and I shouldn't even say they do a lot of tremendous work on the social determinants of healthcare and some of the chronic diseases and the behavioral health and the youth mental health and the housing and the transportation and the food insecurities. All of these things we touch upon. And so we should be really proud of that because people play well in the sandbox up here, and that's not always true everywhere else. And I've learned a lot about it. It wasn't really my bailiwick, but it's been a tremendous experience for me. So I want to thank all the folks that are involved in that. And I think, can I stop now? You want me to go keep going? We want to, what time, how are we doing with time?
8:45.
Go to Bob? All right, so, there you go. I'm getting the hook. So what I'll do now is I'm going to turn it over to Dr. Bob Baldor. About 4 or 5 years ago, probably 4 years ago, you know, we sat around in a conference room at Franklin, and I was with Bob, a colleague of his, and Dr. Artenstein. Dr. Andy Artenstein is the head of the Baystate Medical Practice. He's our chief physician executive. And we were talking about the family residency program and, you know, where we were going to put it. And I'm not sure why we were sitting in Franklin, but we determined that day, I'll never forget it. It's like, you know what, Andy said, we're going to put it here. We're going to do it at Greenfield, and we're going to do it at Franklin Medical Center. And I didn't say anything. I was like, okay, just don't show your emotions. And then after the meeting, I was like, yes. and then Andy hired Bob. And Bob's done an unbelievable job of building the family. This is not easy. You know, just one little piece of it, we turned Franklin Medical Center into a teaching hospital. So that little hospital is now a teaching hospital, an academic teaching hospital. So it's terrific. So anyways, without further ado, I'll introduce Dr. Bob Baldor, the chair of the Family Residency Program.
Well, greetings. I won't spend too much time. I don't want to run us over. I got to say, though, I drove up here this morning. I see an ambulance out there, and I'm thinking, like, oh my gosh, I got to work already. So it turns out it was an ice cream emergency, and if the chocolate is melting, I'm on it. I'm not sure who's doing the slides. You want to advance these for me? Yeah, there we go. Keep going. Keep going. Keep going. All right. So let's keep going. There we go. Let's start here. So let's go one more, just for the sake of time. Go ahead. All right. So a little bit of background. So a little bit of this is trying to understand what is this all about, and how did this come about, and so I think it's important for people to understand this. This actually all started when the medical school in Worcester decided to develop a Western campus out here in the Pioneer Valley, and so we developed this new PERCH program here at in Springfield. And it's called the Population-Based Urban and Rural Community Health Track, the PERCH track hit the so I've been in Worcester for the last 30 years, and I was part of the group trying to help make all of this happen. And as part of that, they said, you know what, we really need to be thinking about having family medicine as a component of this and to make it happen. And as you heard, we really felt that this would be important and really helpful to help support Greenfield and Baystate Franklin Medical Center as part of this. So the medical students that are part of the PERCH, so this is the PERCH, what's happened now, the medical school increased its class by 25 students a year. They're part of the PERCH, and they're admitted to this track. The first 2 years are still primarily in Worcester. The last 2 years are all in the Pioneer Valley. And so we have offices and medical schools and classrooms and so on in Springfield as part of that. And so to me, and a lot of this has been the collaboration, how do we get students to think about future careers in places like Greenfield? You have to expose them to the different things that happens, the different options and so on. So we've worked a lot with different community agencies and Phoebe around, can we expose the medical students to different experiences up here, and we do a lot of that. The other piece of this, though, was to develop this residency. So for those of you who understand how we train docs, right, you do undergraduate, and then you do 4 years of medical school, which is what UMass Medical School is, but then you have to do a residency program to become a board-certified physician. So the primary care piece of this is family medicine. And actually, just back it up for a minute, I'm sorry. The reason why we, back it up one more. Back it up one more. I need the clicker again. So the reason why we decided family medicine, a little bit of this is why family medicine as opposed to med peds, pediatrics, internal medicine, primary care, something. So the reason for doing family medicine is that family medicine is the old general practitioner. And so the old general practitioners sort of dusted off and with additional training and skill set to be able to take care of, and the reason called family medicine is to be able to take care of everybody in the family. Okay, whatever walks in the door. So we're trained to take care of children, infants, adults, and elderly. And that folks, when they finish their medical students who choose family medicine, do this because they want to do primary care after they finish their residency program. 85% of people who train in family medicine stay on and do primary care practice after, as opposed to something like internal medicine. 85% of people who finish internal medicine residency programs go on to become ologists. They go on to become cardiologists and gastroenterologists and so on. So that's sort of a little bit the difference. And so that's probably why we focused on family medicine for this, is to really have primary care training. The other reason for locating it here is if you look nationally, 65% of folks will stay where they train. Really hard to recruit trained docs to come to the area, but if we train them here, the likelihood of them staying is really high. So that's the focus and why we decided to do all this. That's the background. Go ahead and hit it. So the residency, we're fully accredited, and as we said, we had to get Franklin up as a sponsoring institution. You heard about the JCO accreditation. Well, there's all kinds of other accreditations that we've had to go through. The ACGME, American College of Graduate Medical Education, we're fully accredited. And the reason for doing that is, like, how do you actually pay for these residency programs? Believe it or not, Medicare picks up a lot of the expenses related to the residency. And as a sponsoring institution, we will eventually be able to capture this Medicare funding. Huge investment, by the way, to get this thing up and going as part of it. Once we're up and going, a lot of the costs will be supported through the Medicare program. So it's the family medicine program is 3 years long. You're training for 3 years. We're going to have 4 residents a year. So when we're fully staffed, you'll have 12 residents at a time that are here. And the bulk of the training really is here in Franklin County. Now, we don't have everything we need here at Franklin County, so the residents do spend some time in Springfield. They're on the pediatric wards, the pediatric emergency room, some of the labor and delivery and so on in Springfield to get that additional training that they need that we don't have here. I was actually able to secure a $750,000 HRSA grant to help support the program, which was really federally funding to get us up and going, and as I say, a lot of investment to get this program going. The other big piece of this, of course, as you've heard, you want to hit it please, is the 48 Sanderson Street. So family medicine is really an ambulatory outpatient specialty, so which means we have to have an ambulatory outpatient training facility site in order to train these docs. It can't all happen in the hospital. So what you learn about taking care of somebody in the ICU is not exactly the skill set you need to do to to learn how to keep them out of the ICU. And as Ron said, the real goal here is keeping people healthy, keeping them from getting so ill that they need to be in the hospital. So 48 Sanderson Street is where we're renovating this to turn it into so we started with 48 Sanderson Street saying, let's just renovate this so that we can accommodate the needs of the teaching program. Then over time, as we thought more about this, it was, let's do the whole building and turn it into a health and wellness center. So that's the whole excitement around the building. And I got to tell you, this is really cool, is the foundation and you folks locally here have been amazing in your support for this. We've already raised over $600,000 to help with the building fund. And by the way, originally, just to let you know, we were looking at about a $2.5 million renovation cost to get this thing up and going. Well, unfortunately, this thing, COVID happened, and then it turns out once we got into that building, we realized it's an old building over there, and it needed a lot more upgrade, I think, than had been anticipated. That cost has climbed to $4.5 million. So we were originally thinking $2.5 million. It's actually, we're into it now for $4.5 million. Thank you, Ron. As we're going along. And so we've been looking for some support around that. We've been wonderful that the legislature has actually secured some funding to help with this too. That was working through Senator Comerford's office, and we're continuing to look at some additional supports for that. But really, I got to say, a real thank you for the community. It's amazing to me that the businesses and different folks in the community have stepped forward to help contribute to this. I will say, though, the very first contribution was $25,000, and that came from the medical staff at Baystate Franklin Medical Center. They are so excited about this program because what it actually does, even though it's talking family medicine, it actually helps to support the hospital, helps to support the specialists. They're excited about being involved in an education program. Next slide, I'm not sure I'm doing time-wise here. So we're trying to recruit people. So we're recruiting. Our first cut is we want people that are academically sound as part of it. A key is tied to the local area, so we're looking for folks to stay in the area. So we're not looking for folks to come here and train and then head back off to Montana or whatever as part of their training. Our first go-around, we just opened in July. We successfully matched 4 interns and 1 PGY2. And they're all living in the local area. Let's go down to the next. This slide's a little bit old. Click it one more time. And that this is currently interviewing. So, but we've actually interviewed, and we just found out we've got 4 excellent interns that will be starting again here this coming July that we have fulfilled in the match. Of those 4 interns, 3 of them are Massachusetts residents, local ties, want to be back in the area. 1 is actually from St. Louis, but the reason why came on board is because his fiance lives in the area. So again, what we try and do is we're looking for we want to train high quality, excellent physicians. That's number 1. Number 2 is we're looking for folks to stay in the area. That's our reason for existing, is to train folks, provide them with the skills to be able to do this and stay in the area. So let's go to my next slide. A couple of other initiatives. I'm just going to, as I mentioned here, the UMass medical students are involved in a lot, trying to get the medical students. So part of this is our recruitment to our residency. So if we get those Perch medical students out of Worcester, out of Springfield, to come up here during their medical school training, then they're more likely to come here for their residency training. So lots of outreach for that. And we were able to secure another grant. It's called we call it now the Baystate Franklin Medical Center AHEC. Another HRSA grant. It's $125,000 a year for 5 years. And what that does is that whole initiative is focused on the medical students, to get the medical students up here and to be involved in different activities as part of it. And the next slide, next hit. This is my last one here. I need to let you know we're really, even though I'm talking a lot about family medicine, once this site is done and built, we're going to be multidisciplinary in our training. And I was thrilled here in January, just got another grant. This was to enhance the mental and behavioral health training of our family docs. And this has been a huge problem, obviously. It's amazing to me to see how this has unfolded, the stress that's out there, the issues that everybody's dealing with. And we're seeing this more and more in our children, which is really sad. And a lot of that floats into the offices, into the family medicine, the pediatric offices as part of that. Well, we need to get additional resources to help with that. We need additional training to be thinking about how we do that. We were able to secure this grant. It's $325,000 a year for the next 5 years. And we're actually going to have, Barry Sarbert, who's the chair of psychiatry at Baystate. He's a pediatric psychiatrist. And this grant is actually supporting him to come. He will be at 48 Sanderson Street here once a month in our practice. So we actually have a pediatric psychiatrist. We've also been working with CSO around supports as well to be able to provide these services here in Greenfield. And so this is, again, it's going to take us a little while to get this up and going, but we just got this grant to help support those initiatives. And then finally here, again, as I say, multidisciplinary, this other grant we received is to train rural community health workers. So even though we're talking about our primary focus is around docs, primary care docs, we are going to continue to do this outreach. And I think over time, thinking about how can we work more closely with Greenfield Community College, working with nursing students, working with other ancillary staff to provide that training environment there as we're done. So we're in the midst of this renovation. We're all crunched in. And the hope that this renovation will get done. Ron said by the end of the year. I'm really hopeful that it will be all done by the end of the year as we go along. But anyways, thank you all for your support and your time, and I really appreciate it.
Thank you. We are so lucky to have Baystate Health in our backyard. At this point, you've probably noticed that we are missing someone very important. Marian has given me permission to share with you all that yesterday while we were at the office preparing for this breakfast, she experienced a non-life-threatening medical emergency and was taken by ambulance to Baystate Franklin. She wants you all to know that she's okay. And she still expects you to tuck your strings into your name tags at the end of the breakfast. But it was definitely one of those situations where it was a little scary in the moment, and I think Lisa and I both have a fresh appreciation for our local first responders and for the entire team at Baystate Health, and for the incredible care that they gave Marian, as they do for all of our neighbors, which we're really grateful for, because as we've seen, especially over the last 3 years, our individual health is completely connected and a direct correlation to the health of our community. And the health of our community can affect our business, our families, really every facet of our livelihood. So, I was pleased to hear both Ron and Dr. Balador talk about population, because like many of you, I am deeply concerned with the declining population in Franklin County. And while there are a number of factors that contribute to attracting young families and new industries and a vibrant, capable workforce, healthcare and the success of our local healthcare systems is certainly one of that. So while I'm, glad that we have so many folks who are employees of the healthcare system, our community hospital is certainly an asset to attract other employees and new businesses to Franklin County. And it's really critical for the growth and success of Franklin County as a whole. So, as community members and community leaders here, it is our collective responsibility to support our local healthcare providers and to support Baystate, because it's essential for the continued growth of Franklin County. I am lucky to serve on the Baystate Franklin Community Advisory Council with Ron, and on the opioid task force with Ron and Phoebe, and there is just so much great work happening. So I'm really grateful that you were all able to come join us today and hear some of the updates. So I have 3 quick requests before we take off. First, we talked a lot about, some 30,000-foot view of healthcare, but, I've been at the hospital yesterday with Marian, and it's actually the second time I found myself at Franklin ER in the last month, and I just was so incredibly impressed with the care that was given by all members of the Baystate team, and also I guess less impressed with the appreciation that they received. And so my first request is that we all go out and we thank someone who works in healthcare today. So it doesn't have to be, we should definitely thank Deb apparently, because she's running the county. But please also consider, nurses, those working in nursing homes, schools, mental health care facilities. Find someone and say thank you, because we owe them a debt of gratitude. We all find ourselves at the hospital at some point in our lives, so please say thank you. They do not hear it enough. Second, I'm going to ask that we take a quick video for Marion, because while we're here talking about Baystate Franklin, she's at Baystate Franklin undoubtedly talking about us. So I think it will really raise her spirits. So I promise I'm specially trained for these situations. We'll make it fast. So all I need you to do is to say, "We miss you, Marion," and wave, okay? Okay. Let it back up. All right, ready, go. We miss you, Marion. Feel it. All right, and third, final request. Lisa Duvall is celebrating a birthday this weekend, so when you see Lisa, please wish her a happy birthday. And then one last thank you to our incredible volunteers, Michael, Peg, Sharon, Suzanne. It took a whole team of us this morning to pretend to be one Marion. So thank you very much for coming in, showing up, getting done what needs to be done. We are so grateful. All right, so our next breakfast is scheduled for Friday, April 28th. It's a week later to accommodate for school vacation week, but please register. We hope to see you there. Thank you all very much for coming.